I'm Ehsan Malek, Associate Professor of Medicine, Director of Multiple Myeloma Translational Program at Roswell Park Comprehensive Cancer Center. I went to med school in Iran. The name of the school right now is Shahid Beheshti Medical School, but I like former name Melia School, so I came from Melia School in Iran. After high school, I was quite a lot into philosophy and literature, if you say. One day I came across a book called Harrison Internal Medicine. And I like in that time look at the preface of all scientific big textbook to see what are they about. And I read the Harrison preface, and it was about what is exactly medicine. Is a mixture of art and medicine and deductive reasoning and so forth, deductive rational. And I really liked the medicine at that time. And later on, I was kind of a volunteer audience in the club of resident and fellows. They were discussing New England Journal of Medicine cases, and I was listening to them, and I really fell in love in medicine in that time, in internal medicine, the nature of the rationalized, the how you get to diagnosis and so forth. That was the beginning of the journey. We went to medical school and internal medicine, and then all of our text was coming from United States, all of the journals and so forth. I said, well, I should go to United States. Then I'm here. Basically, I apply a research position in University of Southern California in Los Angeles. It was in a cancer lab, a basic science cancer lab, that we were looking at different therapies, looking at the vessels in the cancer, how we can suppress vessels in the cancer and cure the cancer in that time. And that was my first encounter to a very serious science, basic science, and I fell in love with the cancer biology and immunology and all of those. And then I started to be recruited in residency and fellowship. And in fellowship, I had a mentor from Arkansas. Arkansas is very good in multiple myeloma, and that was the strike of multiple myeloma love in me, and later on immune therapy. And I got to research in immune therapy last 8 years as a faculty in Cleveland. We were basically bringing some oral immune therapy to treatment of myeloma patients, and we were quite successful in dendritic cells vaccine and so forth. I would say immune therapy, and specifically cellular therapy, is the main one in our field. In general, cancer is caused by compromised immune system. However, for multiple myeloma, immune compromised T cells and immune cells in general, they are very relevant, they are very crucial. And whether this immune compromised cells comes from disease itself or treatment of disease, in both cases, we can deliver a treatment called cellular therapy. In that treatment, we take immune cells and genetically engineer them to enhance the anti-cancer property in these immune cells and give it back to patients. So in this way, basically, we have a shortcut to have a better immune system to fight with the cancer. I think cellular therapy is the main things that in myeloma are going to be relevant another 10-20 years at least. Cancer in general is a bad news. It put people in a vulnerable situation, and oncology doctor-patient relationship is very honest, I would say, is based on 100% trust. And I really respect and I love this 100% trust that patients, they put in us. And that's the main things that really I love about my job. I've been in funeral of my patients. I sat with their family, listened to their stories. So these are footprints on my, it built who I am right now. And other than this patient-doctor relation, I love the science aspects of that. That's the, is always interesting, how immune system works, how interaction of cancer and immune system works. So there are part of that doing cancer and treatment of cancer is not hard for patients as well as doctors, but it's very rewarding actually. The days that I see patients, I would say there are special days. Science is as a hobby. I love hobby. I don't look at science as my job. As a hobby, I really enjoy reading and talking science, but patients interaction is something that I do as a job, and I take it very serious. We are building a very nice cellular therapy program. We have a massive momentum. We are attracting huge talents across the country in Roswell. I think Roswell gonna be in the edge of that treatment very soon. From entire world, we can attract different patients. We can serve a variety of patients population from different backgrounds, different, myeloma is very heterogeneous disease, and we can provide cellular therapy for them. I think that's the main reason that Roswell, other than excellent staff, nursing, and so forth.